Hi, welcome to Health Beat. I'm Dr. Chris Bennett with Orion Family Spinal Center, and joining me today is my guest and co-host, Frank Granett, who is a published author and also a pharmacist that's been practicing here in the area for quite a number of years. And so today our episode is going to be on neurobehavioral disorders, particularly ADHD. And so Frank, if you could just tell me a little bit about yourself and a little bit about your organization, because you founded an organization here in the state of Michigan.
Yeah, the organization, Dr. Bennett, is the Coalition Against Overmedicating Our Youth. And it's not that we're against medicating young children, it's that we're looking for the most advanced assessment processes to help children find the causation of their neurobehavioral condition before we go to premature drug therapy. So that's our objective, and now it's a nonprofit educational public charity. It's a state of Michigan public charity. And a bit of background about myself, I've had approximately 27 and a half years of pharmacist experience, and I'm currently the clinical director of pharmacy operations at the Behavioral Center Psychiatric Hospital in Warren, Michigan.
Okay. So, when did the Coalition Against Overmedicating Our Youth get started?
Approximately 3 years ago, and it was a passionate endeavor. My son's very best friend died from suicide due to bipolar disease at age 20, and since that point, I recognize there's a tremendous need, not only in our area but across the country, to help children and young adults get the appropriate assessments before they go to that premature drug stage. Because once you enter that stage without ruling out the causes, of these type of conditions, then we're just band-aiding the condition, and actually the condition may get worse, and in many cases it does. Right now, Dr. Bennett, we have over 12 million children and young adults on some form of stimulant ADHD medication or psychiatric drug therapy. So it's an alarming trend, and that's why I wrote the book, The American Epidemic, and it's a solutions-based book.
Right. Yeah, tell me a little bit about the book, The American Epidemic. I know that was something that's just got released. Is that correct?
Yeah, it just became available late July and out of New York City, and it's The American Epidemic and Solutions for Overmedicating Our Youth. So it's a solutions-based book, and we go into an action plan. And many parents out there are looking for solutions. They want to know how I can get my child appropriately assessed to rule out the premature drug therapy, before they go down that route. So what we do, I basically went through and gave a strict action plan, a 1, 2, 3 step of what you have to do. And we go into these factors, and there's risk factors many parents and even educators aren't aware. We all know about the nutritional risk factors that are out there, but we go into the physiological as well as the environmental risk factors. And when you do that, you can actually give a child or young adult a fighting chance to find out that causation.
Yeah, I know with upper cervical care, and those of you who have been viewing the show for quite a while, you know that this show is based on health topics, and ultimately myself, I'm an upper cervical chiropractor, and so I like to relate a lot of that to upper cervical care, and I know you and I have managed several patients together, and we know as upper cervical doctors that there's more to health than just making sure that the brainstem is clear and that the brain's communicating with the body. That's a big part of it. That's a huge part of it.
Right.
And in my opinion, the cornerstone of it, the most crucial part. But there's also other aspects of it that we look at, and that I think you outline in your book when we're looking at nutritional standpoints, like what is being taken into the body that could be exacerbating or making the condition worse, and ultimately, what else is going on from a cognitive standpoint.
Right, and we actually, through our coalition, and when you go on our website, Dr. Bennett, CAOOY.org, there's a wealth of information. When you go to Ask the Pharmacist tab, I do personal consultations, and one of the key factors I'll go after, like you just mentioned, upper cervical care, but there's also that relationship between the brain and the gut or the stomach. And we talk about that in the book, and we let parents understand it's a critical piece. There's more neurons innervating our stomach and small intestines than there is the entire spine. And why is that significant? You know and I know that the precursors for the neurotransmitters that are actually helping children focus and be attentive, those precursors are actually manufactured in the stomach and small intestine. So it becomes very critical that we get into a good nutritional program. In other words, what we're taking in, elimination factors, and supplementation. I'm a firm believer that children nowadays, there's not enough nutrients in our food system today to help children get back on track. So we have a great nutritional intervention program as well. And then we get into physiology. I mean, it's just a huge amount of assessments out there that we can help parents help their kids.
Yeah, we look at it more from a physiological standpoint. Yeah. How are things functioning? And, right. And as long as we've got the proper brain-to-body communication, then things are going to start functioning properly. But ultimately, like you said, and I would even say that even those people who are like eating good vegetables, a lot of our soils are lacking minerals and nutrients that they need to grow vegetables that we grew 50 years ago. You know, it's not the same soil that it was, 50 years ago.
And it's not even that. I mean, the fact is that is important to get your child on a good whole foods diet. And when you do that, you're starting the action plan. Okay, now we got to get into the child's metabolic condition. In other words, a very common, and I talk about this in depth in the book, where many of our children and adults, if you will, they have what's known as a reactive hypoglycemic response about midday, 12, 1 o'clock in the afternoon. And there's a reason for that. And I explain it step by step, what's going on in the body and how this child is reacting to a sudden drop in blood sugar due to excessive carbohydrates in the morning or sugar in the morning, and how to alleviate that. What do you have to do step by step to alleviate that problem? Because many of our kids, the actual ADHD-like condition resembles a reactive hypoglycemic metabolic condition. It's very, and when we intervene on that, many children bounce back right away. So
bounce back very quickly. So.
Yeah.
Well, definitely check out Frank's book, The American Epidemic. A lot of great information in there. And for now, we're going to take a break. And when we come back, we're going to talk a little bit more about ADHD and what exactly ADHD is. So stay tuned to Health Beat.
I'm Oakland County Sheriff Mike Bouchard and former Red Wing great Joey Koster reminding you to follow the rules regarding boater safety. Always operate at safe speeds, avoid alcohol, and wear a life jacket. Don't let a great day on the water be ruined by bad decisions.
Hi, welcome back to Health Beat. I'm Dr. Chris Bennett with Orion Family Spinal Center, and we're joined with pharmacist Frank Granett, and expert ADHD advisor. And Frank, we were talking over the break, we were discussing about ADHD and what it is. Can you tell us a little bit more about that for our audience?
Yeah, ADHD is attention deficit hyperactivity disorder, and actually it's a subset of the parent attention deficit disorder. So it's actually a subset of the overall diagnoses of ADHD, of ADD, sorry. So ADHD now has become more prevalent because it affects 2-to-1 ratio males to females, and now currently over 12% of our child population, that's 18 years and younger, are diagnosed with ADHD or some form of ADD. And now the adult population is actually escalating to over 4% of the entire adult population in the United States with ADHD. And so what we have to realize is, why is this trend occurring? Why is it now at epidemic status? So, and like we talked earlier, we have to go through these risk factors. We talked about them earlier briefly, the nutritional, physiological, as well as the environmental, before we go to drug therapy. And you know, when we do that, we find some very pleasant surprises where even adults with that fog in the midday and they can't focus, et cetera, there's a reason for it. And we show them through the book and our educational DVD that we marketed last year, and it's still on our website, to help people understand what they have to do. What's that 1, 2, 3 step before drug therapy?
And I know we were talking over the break also, and you asked me, we were discussing how upper cervical care actually can affect things like ADD and ADHD. Right. And what it boils down to is that the brainstem, which sits right here at the base of the head, controls so much in the body, and it actually has neurofeedback centers that go into the brain from the brainstem. And so what happens is when there's either too much or not enough signal going in and out of the brain actually has a really difficult time focusing. And because there's different things firing in different areas at the wrong intervals and all those different things going on. And so the brain has a really difficult time focusing and kind of synchronizing. And so, one of the things that we're able to do with upper cervical care is to normalize the signals coming in and out of the brainstem.
Yeah, and the thing is, in our consultations through our coalition, our nonprofit organization, many of our parents aren't even aware of minor concussive injuries, and this is a growing trend across the country in our even our elementary schools all the way up to high schools with sports and activities and whatnot. You just don't know if there's enough brain shearing going on that could precipitate the onset of these type of behaviors, and lo and behold, there's many studies now, and we're seeing it today where, you know, with many of our professional athletes, and it's causing these neurobehavioral disorders, including ADHD. So what we have to realize, and that gets to our physiology that we're talking about, where that's one of the risk factors. And you know, the other thing, we get into the ocular problems. There's a study out of University of California at San Diego that came out, and they were looking at adolescent males at 2-to-1 ratio, like I said, of attention deficit hyperactivity disorder diagnoses. And what they found was many of these adolescent children are basically, it's an ocular problem or a lack of ocular muscle development from birth. And and it's a very easily diagnosable type of condition, and there's exercises for it. And once these kids basically had the rigorous exercises to basically strengthen those ocular muscles, many of these kids rebounded from the ADHD symptoms. So it's one of many, like I say, and many of our schools now across the country are now starting to screen. It's called convergence insufficiency, and what that'll do is kind of rule out that one physiological ocular problem that may precipitate ADHD.
Right, and just for our audience who might not know what convergence is basically how the eyes focus on an object. As the object you know, comes closer or farther away, basically how both eyes are able to focus on it. And you know, as part of the, you know, the connections in the brainstem with the different neurological connections, we were also discussing that there are several different nerves that control those eye muscles that are actually centrally located in the brainstem. So it's definitely important that that area is free and clear of interference, and that area is communicating like it should. That way, when those when those muscles are strengthened due to lack of strength from birth, which, you know, really begs into question, you know, like what's going on during the birthing process. And
that's a good point. The birthing process, and many of our, we consult with many pregnant women as well, because in utero, when that fetus is developing, there's many obviously critical functions that are going on, but one of which is neuroprotein synthesis, and these are critical points in this child, you know, this fetus development. And there's been studies now at University of California, the Mind Institute, and I talk about this in our website, caooy.org, and you can go there to the newsletter, and we have a whole article about this. We have a forum that talks about this as well. And that's one of the critical pieces where that development process, and you know, we see autism at escalating rates, and autism and ADHD are on that same spectrum. You know, autism obviously is a more serious condition, but it's relative, and it can be coexisting. And in this study, 30% of all autism cases have a coexisting ADHD component. So what we have to realize, what's triggering the fetus at, you know, while it's developing, what's triggering these neurobehavioral conditions right from birth? I mean, many of these kids are born with these types of conditions like autism. So what we have to understand is it's not just our nutrition for the pregnant mom, it's in our environment. Our environment is far more toxic today than it was many years ago. And there was a very prominent study by the Environmental Working Group and the Red Cross. They assessed the umbilical cord blood of newborn babies, and they found over 200 known toxins. In other words, these are toxins, Dr. Bennett, that, you know, we're seeing every day, like pesticides, even when you're cooking with the Teflon coating pans, those chemicals that are coming up into the foods. Well, guess what? Those are crossing the placenta. The baby is, you know, the newborn, the fetus actually is, you know, getting those toxins. So we have to realize this is a very complex issue, and we have to go one by one to start ruling things out.
Right, and also too, when you think about the physical part of the birthing process.
Oh, right.
As the baby's coming out of the birth canal, you know, not saying it's wrong or right, but just the baby's usually pulled by the head.
Right.
And you know, we tell a lot of our patients that, you know, that babies is really a lot of times where subluxation, which is that misalignment of the upper cervical spine that starts to interfere with the brainstem function, most of the time that actually happens all the way back in the birthing process.
Well, yeah.
Because the baby's being pulled out by the head with the head turned, trying to get the shoulders out. And a lot of times that's where that starts, but it never gets checked and evaluated because no one really knows that it needs to be done.
And the work you're doing is phenomenal because upper cervical care is the critical piece to that neurobehavioral checklist that I have for many people that I consult with. And if we don't do that by an upper cervical specialist in chiropractic care, it's one of those missing links that you really want to make sure it's a good, firm check off, make sure there's clean and good alignment in the upper cervical area as well as the entire spine. But you know, I really truly believe that if parents and educators, and that's the people that we really want to focus on, are the educators across the country. Many of our public schools now across the country are actually recognizing these key types of assessment interventions. And it's one of many I talk about in the book, The American Epidemic, that when you go through step by step, one by one, and get these different types of assessments done, you know, we can get these kids back on track before we go to premature drug therapy.
Yeah.
So.
And now, like you said, get them back on track as far as their neurobehavioral disorders, but also their overall health in general too. You know, we're talking about allowing the body to do what it's supposed to do. It's really designed to heal itself.
Right.
It's just most of the time, it's that ability to heal itself is actually being interfered with. And so it can't do what it's designed to do.
And that's the interference that we want to prevent or let parents and educators understand. It's interference that we want to get back to norm. And when we do that, you know, great things do happen.
Right. So. And just to, you know, as a side note, but really on topic with this is that upper cervical care really isn't a treatment for any condition, just as nutrition is not a treatment for any condition.
Yeah.
And it's certainly not a treatment for ADHD and ADD, but what we find is that when those parts of the body are not working properly, then you're much more likely to have some type of neurobehavioral or some type of physiological abnormality going on, which causes a host of different problems.
That's like many of the children and young adults that I consult with their parents as well. We find many C-section babies, even worst case scenario, because you know, an emergency C-section is a very traumatic situation. Normal birth is traumatic for the mom and the child as well, but you know, C-section even more so. And then if you get concussive injuries, you know, while the child is growing and getting into different activities, you know, these all figure into that physiological checklist that has to be done. You rule it out, and then we go to the next step, and what's the next assessment? Right. All we've been doing, Dr. Bennett, through the last 40 years or 4 decades is going after behavioral assessments. That has changed. Many of our psychiatrists, prominent psychiatrists across the country now, recognize writing that prescription for a stimulant or psychiatric medication in children can no longer be unless these comprehensive assessments are completed. Right. So
I agree. So we're going to take a break, and then we'll come back and wrap up our show. This has been Health Beat. Hi, welcome back to Health Beat. I'm Dr. Chris Bennett with Orion Family Spinal Center, and I'm with pharmacist Frank Granett and also ADHD expert advisor. And Frank, we were talking earlier, and I'd like to talk a little bit more about your book, The American Epidemic. You stated in that book that one of the driving forces behind publishing the book and getting the book out there was the suicide of your son's best friend. But what is it that keeps you going, that really just keeps you driving? Because I mean, you're against all resistance. You're just going, and that's.
Yeah, it's one day at a time, Dr. Bennett. And I tell you what, when you see the positive responses and the positive turnaround cases that we've had, and collectively, you and I have shared some of those cases together and worked on different types of cases and to a positive result. But you know, during that time, it was about 2011, and it was during that point in time, about August 2011, one of the largest drug audits was coming to note. In other words, the results were coming out. It was a 2-year drug audit. Now, This is a drug audit authorized by the Government Accountability Office, United States Government Accountability Office, and it was a 2-year drug audit from 2008 to 2010, and they were looking at the prescribing habits of physicians across the country in our child foster care system, and these are children as young as age 2 that were getting these type of psychoactive medications. So during this period, 2-year period, the amount of prescribing without assessing children right to stimulant drug therapy and right to psychoactive antipsychotic drug therapy. And we're talking children as young as age 2. This is across the country, yeah. And this is back in 2011, and then my son's very best friend passed about a month later, and that just kept me going, and I knew I couldn't stop. And it's not to say our coalition is against drug therapy in children. Many children and adults get very good positive response with stimulant type of medications, but those should be reserved. Once all assessments are fully completed, then there's room for this intervention with drug therapy. So that's what keeps driving me right now is this, that drug audit was very significant. It was the largest in our country. And it was an assault on our young child population, and that's why I'm vigilant about it now.
Wow. So you're saying they were being prescribed like a high percentage were being prescribed without even
the child foster care.
Any type of assessment?
Well, behavioral assessments, again, the last 40 years we've been mainly, in this type of diagnoses of ADHD, it's mainly a behavioral or environmental assessment.
Right. With
no mention of going after metabolic conditions, no mention of physiology, no mention of nutrition, elimination, the brain-gut connection, etc. All those assessments have been by the wayside. It's just a simple behavioral assessment and immediate drug therapy, and especially our young child population. So we are making ground swells and movement forward to changing all that. Many of our, like I said earlier, many of our prominent physicians are recognizing we need to put the brakes on, go through these other comprehensive assessments I talk about in the book, and when we do that, we're benefiting a generation of kids that are coming forward.
Yeah, and I think too, I think that we've seen a growing trend, and correct me if I'm wrong here, you probably know more about it than I do, being from your industry, but I feel like we've seen a growing trend of people wising up to the fact that maybe the answer is not in the pharmaceutical, prescription.
Right.
Maybe there's something else going on here that's causing some of these issues, not just in behavioral disorders, but just overall in health in general. I mean, I feel like there's a growing trend from the consumer standpoint anyways, where people are really tending to not want to be on the medication as much as they are wanting to find other solutions first.
It's all about information, and when you have the right information, you're an educated person, and then you get that right information, and then you can make an informed decision.
Exactly.
In the last 40 years, that information was not out there, and our public school systems realize this now, and it's not that we are looking at elimination of drug therapy in children. We're looking at these assessments first, and then if needed, then we can go to the drug therapy if it warrants a positive response. So it's something that we're working with education across the country now.
Okay, great. So we were discussing some cases that you and I have worked on together. Well, actually, not just you and I, but other people involved too. Looking from a nutritional standpoint, that's something that I don't do, is a nutritional standpoint. It's extremely important. It's just not my specialty.
But soon you will, though, right?
But we were discussing a case that we worked on, and it was a young man, probably age 21, I believe.
Yeah, right around there. Yeah.
And he was actually, when we first, received his recommendation, or received his case, he was actually had just came out of an institution. Is that correct?
That's correct, and he's doing phenomenal now, and institutionalized for close to 3 weeks thereabouts. But it gets to the point where this particular individual, through the assessment process, through the work you've done, through the work that we've basically worked together, and that's what it's about. It's not just one physician anymore. It can't be.
Right.
Or one discipline anymore. These are very complex. Some of these cases can be complex, but actually some can be very easily solved by nutrition alone. And those are great cases because it's one intervention, and But again, we want to see the whole picture, and like I say, you know, the picture on our website of the child, a young child with her arms in the air in the form of a letter Y, which means why am I not being appropriately assessed? And we're talking about the physiology, the nutrition, as well as the environmental or behavioral assessments.
Right.
And then when we do that, we get a complete package. So there's more disciplines involved. There's more professionals involved in these types of cases. And this, you know, 21-year-old is thriving now, and it's a good thing.
Yeah, they're actually doing really well. And actually, I know when we first made contact with him with that person, and it was very much like a disconnected. Like they weren't. Yeah. They were there, but not there. Not completely there. And
exactly.
You know, from the different treatments, you know, from upper cervical care, you know, receiving upper cervical care and the nutritional treatments, and all those things, he's actually doing really well now, and very connected, just doing magnificent, like night and day difference. Yeah,
and like I say, and this can happen to any child as young as age 2, because the growing trend is preschoolers, you know, physicians, many of our physicians are still going after the drug therapy first, you know, in our preschooler population, which is, you know, not a good thing at all, because these young children deserve better. They deserve appropriate, comprehensive assessments first before the long-term type of premature drug therapy.
Right.
Yeah.
So what I'd like to do now is I'm sure that some of the people out there watching probably have, you know, a lot of questions. Maybe they have a young child in their life that's maybe dealing with some of these issues. And what I'd like to do, Frank, is have you take a second to kind of explain to them where they can get information, where they can get answers, where they can find out more about the action plan that you've laid out in your book, The American Epidemic.
Yeah, it's a very simple website. It's CAOOY.org, and when you go there, just go to the Ask the Pharmacist tab, and all those questions they get fed into my email, and then I will reach out to you and create a dialogue and get things rolling. And it's a step-by-step program. And even on our website, we offer the special shipping for the book. It's free shipping instead of going on Amazon.com. And we also have the educational DVD, which a lot of our you know, when kids are trying to get more visual understanding of something versus reading the book, you know, they can get the DVD and kind of understand it in a more visual sense. So both of those together work very well.
Great. And I also wanted to say that if you have questions about upper cervical care, or maybe questions you'd like to have answered by the show, you can always email me, Dr. Chris Bennett, and my email is orionfamilyspinalcenter@gmail.com. And Frank, I want to take a second to thank you for being on the show today and for being with us. And thank you for the work that you're doing with our youth and trying to find alternative answers for them, because unfortunately it's kind of sad what's happened to some of the youth. And so I want to thank you for being a champion of that and for doing that and taking that forward.
Oh, thank you.
I'd like to have you back again sometime, if that'd be all right.
That'd be great. We can get in depth on a lot of things.
Great. Well, thanks again for joining us. And my name is Dr. Chris Bennett with Orion Family Spinal Center, and this has been Health Beat. Thank you.